Now move to matters education at the bridge with health, and the government has established the cause of the Mukumu Girls High School illness to be a mixture of enterotoxigenic E. coli and Salmonella typhi bacterial infection as a result of contaminated water. The Ministry of Health further confirms that over 600 girls from the school suffered the illness, while 19 others in critical condition continue to fight for their lives in 7 health facilities across the country. Lois Ongoi reports.
Concerns that the deaths of 1 teacher and 3 students at Mukumu Girls High School was as a result of contaminated food or water have now been confirmed by the government. Food and human tissue samples tested positive for a mixture of enterotoxigenic E. coli and Salmonella typhi bacteria, causing the illness that caused fever, abdominal pains, vomiting and diarrhea. The Ministry of Health further explains that the disease that has so far claimed 4 lives from the Mukumu Girls schooling community usually occurs when water sources are contaminated. Now, MOH is advising schools in the country to ensure personal hygiene, treat or boil drinking water, use toilets properly, as well as improve sanitation around food handling.
Of laboratory investigations, blood samples were taken, stool samples were taken, food samples were also taken, and as at today, what is causing our girls to have those symptoms appears to be contamination from food and water.
The Parliamentary Committee for Health has questioned the closing of Mukumu Girls High School to allow medical intervention for infected teachers and learners. Their argument is that the Mukumu schooling community is spreading the disease back home, these utterances exposing the government's officials' ineptness in handling Mukumu matter. Now, MOH warns that the mixture bacteria disease has high potential of person-to-person spread, especially in congregate settings where people live and eat in close proximity, perhaps informing remarks by the Parliamentary Health Committee that perhaps it would have been wiser to quarantine and treat the students at school instead of closing the school in order to arrest the possible spread of the disease.
Na ukiwa na outbreak ya ugonjwa, jambo la kwanza la kufanya ni kucontain hiyo ugonjwa. Kwa hivyo jambo ambalo angelifanya ni kudeclare hiyo sehemu kuwa ni quarantine na tuweze kuatibu katika hiyo mazingira bila kusambaza ugonjwa kwa watu wengine.
But MOH adds that they are currently conducting more tests to ascertain any other potential cause of the illness and will communicate the findings soon. Meanwhile, 1 student from Kasoko Boys High School in Bungoma County has died, causing the school to shut its doors after doctors confirmed that the deceased suffered stomach pains leading to his death.
Postmortem ilipofanywa imeonyesha kwamba alikuwa na perforation katika utumbo wake, ili ilimletea ugonjwa wa tumbo unaitwa peritonitis, na hiyo ndo chanzo cha kifo chake.
Meanwhile, the family of the late Juliana Mujema, a teacher and boarding mistress at Mukumu Girls High School, continue to mourn their beloved one who is survived by a husband and 2 children.
Julia herself rang me and called him, "Mama, come on the ground. Things are not good." Left home, immediately came to Mukumu. Got her sleeping on her chair. Very restless, the body pain.
Lois Ongoi, NTV.
No, Agriculture Cabinet Secretary Mithika Linturi has denied reports